The only unique identification code for citizens in this country is your PPS number.
Thank you, Deputy.
We need to have a database that will be interrogatable in relation to who gets the vaccine, who doesn't get the vaccine, underlying illnesses, age and everything else.
Thank you very much.
I presume for December the 11th, all of this will be announced as regards what we are doing in all of these categories.
Taoiseach.
First of all, say to the Deputy that I set up the task force because this is an issue of national priority which goes to the very top of government. And I will stay on top of this until we get everything sorted. And let's be clear, a lot of the experience, expertise resides in the Department of Health, the HSE. They have been involved in previous vaccination programmes, a range of them, the National Immunisation Committee and so on. So there's a lot of residual expertise and experience there that one has to draw upon. And just for the information of the House, Pfizer, BioNTech and Moderna would have sought market authorisation yesterday from the European Medical Agency. And Emer Cook, who my son is an Irish person, briefed health ministers this morning. And they will assess, at the latest, they will assess the Pfizer-BioNTech vaccine on the 29th of December at the latest, maybe before that. But I think it's very, very important, notwithstanding what happened in the UK yesterday, that the responsibility of that authority is huge in terms of recommending a vaccine as being safe and effective. And we shouldn't in any way create a pressure zone on the regulatory authority to do the right thing here. And I'm just saying that generally, and I think that's important. In terms of the work of the task force, work is proceeding at pace. I mean, yesterday, so delivery was taken of up to 9 ultra-low fridges, trucks into the country. They're stored out in City West. So the work is proceeding at pace. You're correct in terms of we know what the essentials of this are going to be. Logistics is a key work stream that's being worked on. The IT infrastructure, an entire database will have to be created in terms of who gets what. The workforce, who administers a vaccine, that's being worked on. Because of the scale of this, it will be more than just the normal workforce that would apply and administer a vaccine. Surveillance and monitoring, interpreting of the data subsequently in terms of how it's working, what are the outcomes and so on. The sequencing, who gets the vaccine first and in what order and how it happens. And of course, communications is going to be vital as an important strand. And then the overall governance and oversight of the operation. So in terms of the Pfizer-BioNTech, the infrastructure is already coming into play in terms of the low ultra-storage fridges that have arrived into the country. They will be commissioned by the middle of next week. And then the issue is they have to be distributed within 5 days from the central depot when a vaccine ultimately arrives here. The view is that Moderna, I think the EMA are looking at early January in terms of a meeting to assess market authorisation application that they've put in
Thank you,
place.